Hi, I'm Jeff Todd, President and CEO at Prevent Blindness. Welcome to the Focus on Eye Health Expert Series. Joining me today to discuss glaucoma from a public health perspective is Dr. Karen Allison, an ophthalmologist and associate professor at the University of Rochester's Flaum Eye Institute. She's also chair of the Vision Care section at the American Public Health Association, and we're so honored that Dr. Allison recently joined the board of directors of Prevent Blindness, where she serves as chair of our scientific committee.
Thank you. Thank you. It's my pleasure to be here and to be a part of the Prevent Blindness Board and Scientific Committee.
Terrific. So you're the lead of the Population Medicine Glaucoma Division at the Flaum Eye Institute. Can you explain what population medicine is?
Sure. Thank you. That's a wonderful question. Population medicine is encompasses all the actions taken to promote the health of a population. And in that, it entails whether it's that their health is attributed to their educational background, their access to healthcare, their nutritional aspect, all these factors that encompasses a patient's healthcare.
You mentioned this, but can you talk a little more about how improving equitable access to care fits into that work?
So when you think about population health, you're also thinking about the diverse group of patients that is in a society. So whether it is their racial, ethnic background, whether their socioeconomics, um, all the patients that encompasses a society. And one of the things that we want to make sure is that each patient is getting equitable care, meaning that no matter if you have insurance or the type of insurance you have, they're all getting the same amount, the best care, quality of care that they can. So with health equity, what we have over time have noticed is that certain populations were not getting equitable care, whether it's because of access to care, whether it's because of their lack of insurance, whether it's educational, whatever the issues were, they were not getting equitable care. So therefore, there was disparities in treatment, disparities in outcome, disparities in disease progression. So my specialty or my goal is to increase education in this area and also allow patients, no matter what their issues are, to get equitable care no matter where they go. And unfortunately, in eye care, no different than any other part of healthcare, that's been a struggle.
Yeah. Well, I know it's an ongoing challenge.
Yeah.
So you're also involved in various clinical research projects. Are there studies you're working on that might offer new hope for glaucoma patients and their families, or new insights into how glaucoma care is provided?
Yeah. So as being in population, I'm working on every area that can affect patients' care. So one area that I'm working on is obviously try to find new ways of diagnosing glaucoma earlier. And one way is early screening, glaucoma screening, whether it's in person or via telemedicine. The second is education, educating your patient, the population, about what glaucoma is, and to let them realize that early diagnosis is essential in order for them to get treated. The earlier you're diagnosed, the better chances you are of not progressing to blindness. The third thing is to think about other ways that you can diagnose glaucoma. For example, genetic testing. So we know that there are certain genetics that are seen with certain diseases, and glaucoma is no different. So that's one area that I'm interested in working with to see if we can get a more risk association with glaucoma, and therefore earlier diagnosis and earlier treatment.
Yeah, I think, interestingly, just as an aside, the genetic testing is so important. It's great that if we know our family history, but I was talking with a friend last night who's adopted and struggling with not understanding his healthcare history. And so genetic testing can be really helpful for people who don't have that comprehensive understanding of their family, their biological family. Um, so the CDC and their research partners recently released a new study addressing the prevalence of glaucoma among adults. This showed that in 2022, there was a higher rate of glaucoma in the US than we previously estimated. Were you surprised at this finding?
No, not at all. Not at all. Because we see so many patients with advanced glaucoma that we weren't surprised with these findings. So the prevalence rate, they estimate about 4 million patients with glaucoma over the age of 18. And we weren't surprised with this. And of course, the prevalence is higher in people of color than, say, Caucasians, about twice as high. But we weren't surprised by these studies.
Yeah. Well, and how do you hope this new data, plus the data from your own studies, will be used? Why is data important in our work?
But then it's important to see one, what the prevalence or what the amount of patients that we think may have a disease, and therefore, and which group has a higher risk of getting that particular disease. So when we see these patients, when we evaluate them, when we check their family history, then we can better advise them on treatment and advise them on follow-up. So if someone is at risk for glaucoma, have a higher risk associated with glaucoma, then they should be seen more frequently. Maybe every 6 months or at least once a year. If they do have glaucoma, say early glaucoma or pre-glaucoma or ocular hypertension, they should be seen more frequently, like every 3 to 4 months. And of course, as the disease gets more severe glaucoma versus moderate glaucoma versus severe glaucoma, then they should be seen at least every 3 months. And once that diagnosis is made, then they can better recommend treatment. And there's so many different treatments now for glaucoma, and they depend on the severity. They should be more aggressive with the way that these patients are treated.
Got it. Got it. And for those interested in finding more about that prevalence data, you can visit the Prevent Blindness website, preventblindness.org, and we have that information on the site. You have more than 20 years of experience teaching residents as the chief of glaucoma at the University of Rochester. How do you see telemedicine, AI, and other advances transforming the delivery of eye care?
Significantly. That's a great question. AI is in every facet of our lives right now.
Mhm.
Whether we want it or not, it's there. So I think educating the patient is important when they come in, because not everything that's on the website from AI is accurate. So therefore, I think patients have to look at what they get online and make sure it's not AI generated versus from a reputable source, for example, prevention of blindness. But unfortunately, AI is with us. And it's not only in the way that we get knowledge, but also in the way that we practice. Because a lot of the system is set up with AI generated algorithms. And one of the issues with AI is that a lot of the studies that were done on AI was not a diverse group of patients. So therefore, some of the results that we have can be very biased. And that's something that we also have to be aware of. The other thing is telemedicine. Now, eye care is very difficult to complete an examination with telemedicine, because you do need to check the pressure. You do need to check the pupils. There's some things that you need to do in person. You can screen by telemedicine, but I think if there's any evidence of glaucoma or diabetic retinopathy or any diseases that you're worried about, then you should actually be seen. So I think it's good for a screening tool, but I think you actually need to go into an office and see a medical doctor, an ophthalmologist, optometrist to get a full eye exam. There may be telemedicine at some point that's able to some form that will able to check the pressure and do all these things. But at this point in time, we do not have that available.
Yeah, we never know what's coming down the road, right?
Exactly.
Uh,
Exactly.
so, in relation to your residents and other upcoming eye doctors, can you share why it's so important to ensure that we have representation in all medical professions, including eye care, from people of diverse backgrounds?
Sure. So it's important to mentor your residents and also teach them how to work with diverse groups. But more importantly, it's important to get a diverse clientele, diverse patients, diverse physicians, diverse nurses, diverse staff to take care of patients because we live in a very diverse country. And we should have representation because some patients are more comfortable working with people that they are familiar with, or people that look like them, or people that talk like them, or have a similar culture to them. And so I think it's very important to have that available to patients. I also think it's important to train residents and future doctors and nurses to become very culturally sensitive and remove some of the biases that they may have because sometimes we see a patient and we say, oh, they're that particular group and this is how they behave. But each person is an individual, and I think we need to go in with clear no with remove as much bias as possible because it's impossible to do that in this world. But at least go in there with an open mind to treat the patient as a patient and not with your include your biases. So I think it's important to have a diverse group of doctors, a diverse group of workers taking care of patients so that they can feel comfortable, so that they can trust the system and trust the doctors with whatever treatment protocol they may advise them to take.
Absolutely.
Yeah.
You've authored a patient guide in glaucoma titled "Why Am I Not 2020?" What are a couple of the most common questions you get from individuals with glaucoma, and how do you address those?
What's the most common question I get with patients with glaucoma is, why am I not 2020? Why can't I see better? Why can't you fix my optic nerve? Why can't you do an eye transplant? Nobody told me that I had glaucoma and I go blind. What can I do to get my vision back? So those are some of the most common questions I get. And I think education is so important to these patients because I think that a lot of them did not know that they had a chance of going blind from this disease. They were told they had glaucoma, but that was it. There was no follow up. And I think now with the computer age and all this data that's out there, they can see that that glaucoma is treatable. It's not curable, but it's treatable. The earlier we diagnose it, the better it is. It's a relationship with your doctor and you, so therefore it's important to follow the guidelines of your doctor. By taking your drops, doing your laser, doing your surgery, compliance is very, very important. Because if you don't take the drops, if the drops is twice a day, that means twice a day. It doesn't mean one and then you forget to take it in the afternoon because the drops only have a certain amount of time to work. So if you don't take it the correct way, that means your pressure is going to go up and it's going to cause more damage. And the more advanced the disease is, the greater the risk of you losing more vision if the pressure is elevated. So, so I just think it's really important that patients understand their disease, either by reading about it or by speaking to their doctors and or the team that's taking care of them so that they can have a better look at their disease and better understand how to get it treated.
And certainly with issues, especially like glaucoma, where it's a chronic condition that they need to take drops generally for the rest of their life. It's constantly reminding them about that importance. I know adherence can be such a challenge for all of us who take medications, and we have to remind ourselves over and over of why that's important, right?
Right. And the other thing too with adherence is sometimes these medications have side effects. They cause their burning, they cause decreased vision, they cause tearing, they cause redness. So sometimes these medications cause side effects and the patients are not comfortable with them. And, if you tell your doctors this medicine is burning, this medicine is causing my vision to blur, there's other options. There's preservative-free medication. There's laser surgery. There's regular glaucoma surgery that can be done to prevent these side effects. But compliance is essential to prevent further damage from the glaucoma.
Yeah. Well, and we're such an innovative space in eye care right now. Who knows what great treatments are
Coming up,
coming around the
exactly.
corner. So,
Right.
well, Dr. Allison, as I mentioned at the beginning, we're so excited that you've joined our National Board of Directors at Prevent Blindness and that you've taken on the role as chair of our scientific committee. What do you hope that you might accomplish in this role?
Well, one of my big tasks is to make sure that the people are educated about their disease. I think it's so important. The other one is to make sure that there's policies that access is available to all, from the baby to the adult. So I think once we do those two things, then anything is possible. And also with the education to let patients know about the new treatments that are coming out, the availability of different options in their treatment. Just so many things that but education and access, and of course, access includes public health. It includes advocacy. It includes insurance advocation. So many things. So those are the I think the two main things that I would like to achieve.
Well, we're really, again, excited to have you on board for that. Now, as we wrap up, is there anything you'd like to say to end our conversation around glaucoma?
So glaucoma is the leading cause of blindness, one of the leading causes of blindness, and it's irreversible blindness. So therefore, it's so important to get your eyes examined early. Make sure that they check your eye pressure. Make sure they check your optic nerve. And if you do have a family history of glaucoma, it increases your risk even more. So it's important to get your eyes examined. And if you're from a minoritized race, whether you're Hispanic or African American, you should get your eyes examined more frequently because you're at risk. And if it's caught early, it can lead to prevention of blindness. If it's too late, at least you can be treated so that you won't get develop into blindness.
Thank you, Dr. Allison, for joining us today. And for those interested in learning more about glaucoma, please visit our website, preventblindness.org. Thank you.